I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And have you ever struggled, in the field of medicine, whether you're a consumer or a doctor, in managing all the amount of information and misinformation out there? I mean, how do you actually differentiate all of that? And then, of course, how do you kind of sort of identify what's important, what's not important, and how do you keep track of all that? And especially as doctors, we're just inundated with so much information and so much new technology. And then guess what? Technology changes all the time. And so the challenge that we have today is simply this, is that we need the right people to guide us to actually first curate the right product, the right service, the right people. Then, and what I mean by that more specifically, because some people might think, well, who's this guy telling me that this person is good or not? Well, it's always context dependent. You have certain doctors that are great for certain things, if you have that particular problem that they're good for, right? But they may not be good for everything. And that's the same thing with products, same thing with services. But sometimes we get confused as the content and context is completely disconnected. So the purpose of this podcast really is about this, is to help you, guide you in the process by which you can discern what's best for you. So it's a decision-making process. So rather than selling a product like many podcasts do, or, they're selling themselves because they're so amazing at one thing or another, it's helping you determine, is this the right person? Is this the right product for me? But one of the biggest challenges that I also see as a physician, I've been in practice, for as a plastic surgeon for the last 25 years, been in the medical space for much longer than that, obviously, is, how do we navigate the information that we have to deal with every single day? And so what are we going to do today? It's going to be a role play. It's going to be a role play where my guests present with a very specific problem. It may be something real to them, or it may be something that they're very aware of. And you might actually be triggered by this particular problem. And then the other will guide them to some form of resolution in about 6 minutes. So 3 to 6 minutes is not a lot of time. However, it gives you a sense of what's actually real. It's relatable. You may see yourself in this actual problem and recognize, what, there is a solution after all. And that's what this is all about, is finding the right people that will help you come up with the right solutions. But at the end of the day, it's your responsibility to make those decisions. And that's a conversation I have with a lot of people. Conversation in our future health management, if you will, has to depend on responsibility, root cause, and data. So once again, it's my honor to be inviting Maggie Solomon and Dr. Hassim, on this podcast. They had a brilliant one last time, and if you haven't seen that, you better check it out, because Dr. Haas and I will be going to the toy store pretty soon. But I'm going to have Maggie first introduce herself, then I'll have Dr. Haas introduce himself, and then we'll go into a 6-minute role play, and then we'll unpack it for about 10 or 15 minutes. And my hope is that you will leave with some sort of insights and an action step that you can take, or perhaps if you are not a doctor and you have a doctor that you really like and you want to give him some insights as to what he can do differently or she can do differently, listen in. Maggie.
Hi, Maggie Solomon here. I currently serve as Director of Strategic Innovations for a healthcare solutions provider. I have been in healthcare technology for almost 20 years now. And I also work with our local community to educate on the latest emerging technologies and also empower women in tech.
Love it. Dr. Haas.
Hi, I'm Dr. Hassim Mohammed. I'm a chiropractor that focuses on structural rehab using chiropractic biophysics. I am in Boynton Beach, Florida, and I am honored to be here with Dr. Bart and Maggie.
Thank you. And this is not your first rodeo with me, and I'm super excited that you come back and that you're trusting this process like the listeners can trust it as well. All right, so let's begin the role play.
Oh, all right. So I am a doctor and working in my office, trying to keep up with my electronic health records. And Maggie is a patient coming in.
Yeah, I'm a new patient looking for just to transition to a new doctor. So this is probably you all relate to this experience. So I'm coming in. Hi, doc.
Yes, hello. Welcome to the practice. I am just gonna take some notes here. I'm not gonna look at you at all because I have to keep up with my electronic health records. So how you doing? What brought you in today?
Good. I sent, did you receive all of my history information, new forms? I sent those over.
Oh, yes, yes. I know you tried to get in a month ago, but it took us a month to actually get the records from your last doctor. And I have it right here. So they sent it to us, and I will look over this tonight while I'm playing with my kid.
Well, there's also some that I wasn't able to get, so we'll probably do those all over again.
Yeah, we're just gonna pretend like you never did that, and then we'll just redo it.
So is this what you go through every day?
Yeah, well, we have to, you're number 245 of 700 that I have to see today to meet my quota. So, and I have to, keep up with all of this. So that would explain why I'm not looking at you when you see I'm talking. And I'm just typing everything that you say. So what's happening?
So you know that, so I actually just want to transition to a new doctor. I'm trying to be proactive, and I also want, I am into now like biohacking and stuff. So I have a continuous glucose monitor on and monitoring my sleep with my, devices. Can you capture that information?
Oh, my glucose monitor devices. Yes, that's great. It's good that you're doing that, and we could go over that if you just write it down, keep track of it, and then next month when you come back, bring that in with you, and then I'll make sure and I'll add that to your record, and we'll talk about it when you come back.
But it's all
No,
electronic.
We don't have the ability to do that right now.
But it's all electronic. Isn't there a way? Can't you just get that data?
As of right now, no. Oh, I just realized who you are. You're Maggie Solomon. I saw your TED Talk. That was pretty amazing. So no, I can't
Thanks.
do that right now. Is there a better way to do this?
There is actually. So can I ask you to just imagine that we're having a conversation and you're asking me about what are some of the data elements that you have to capture on my first visit, Doc?
Your name, your history, your
Okay.
family history, any family history of diseases, any accidents, any falls, any other conditions that
So
you
imagine you don't have to look at the screen. Imagine we're just having a conversation and there's this really cool device, phone, and it's just capturing the conversation, and it actually understands what's clinical and what's important, and it could decipher diagnosis information, vital signs, all the appropriate fields, and put that directly into the record for you. Would that be something that you'd be interested in?
would be amazing. Does that exist?
Of course.
Well, I know my phone's listening because I can see it pops up on my whenever I scroll. So I know it's listening to me, but it doesn't.
It's always listening.
Right.
The
So
phone's always listening. So what we're saying is that since 63% of physicians are experiencing burnout, that there's another way to do things. There's a different way of doing things. We just have to take a step back, and we have to be willing to do things differently in terms of regulation, technology, and data management. So imagine now that data that you have, that pile of information, I had to give another doctor's office permission for you to go access that. But imagine if I had all that access and I could just transfer it to you in a very easy and manageable way versus you having to go through all these different avenues and me having to request permission.
No, that would be amazing. Is that a possibility?
Yes, it is a possibility.
Wow.
All right. Well, that's a wrap, guys. That's awesome. So I'm going to start off with Maggie. What was that for you?
So I've been in tech now for, as I mentioned, almost 20 years, and healthcare, specifically in healthcare too. And what I've seen is that we've transitioned from a disease-centered care to whole health, right? We look at the whole patient, and it's patient-centered care. But from a technology standpoint, we have not adopted the technology and provided that interoperability for clinicians to be able to have access to that information at their fingertips, right? We have systems that have been in place for so many years, but they haven't evolved and adopted to the needs of the physician. We have sometimes technologists developing solutions without engaging physicians. And for me, it's really important that we engage our clinicians into that process, into the design of the technology, and we're giving them access to information. Now, on the patient side, it's important to me because I am a patient and I don't own my data. I have to request permission from all these different systems. And imagine now a chronic disease patient, right? A chronic disease patient has to go from specialist to specialist to specialist and request for permission for their information. And that's not how things should be. We have the technology, we have the tools, we have the ability to do things differently. We just have to have unconventional thinking and be able to have some transformation in multiple areas, not in technology, in policy and regulation, and also data management.
Awesome. Dr. Haas, what was that for you?
That's a real scenario, where I see this if ever we go to any other doctor's offices where, they're barely looking at the patient. There's no real connection because they're so overwhelmed, and myself included. I mean, obviously, I try to pay attention to my patients, but so overwhelmed with trying to keep up with the electronic health records and everything else that's required in order to do that, proper documentation. It's really, you spend the vast majority of your time doing that stuff, the administrative stuff, rather than actually taking care of the patients. So if solutions like that, do exist, it just takes so long to get integrated and before it's mainstream. So yeah, it's a real issue.
Yeah, it's interesting. I mean, with all the technology that's has been evolving on so many different levels, and it'll take hours to explore all of them. But the reality is that how we access healthcare in the next 20 years is going to change dramatically. Absolutely. And a lot of it has to do with how the information is transferred. But one of the key distinctions that I'm recognizing, we talked about this before, is that many doctors are suffering from burnout. Many doctors have PTSD, depression, loss of autonomy, all sorts of things. And there's a lot of history behind that, which I don't want to go into. But the reality is, and this is what most consumers don't recognize, is that because of the advancement of science, because everything's becoming more specialized, doctors have to become more myopic in their ability to address the conditions that people have. And it's just the nature of the beast, by the way. It's not the right one, but it is what's happening, such that the reimbursements as well for doctors consistently decreases every year. I mean, Medicare just reduced it by another 8.3% this year. And patients don't recognize that. They think that doctors earn a lot of money. And quite frankly, I mean, you can have plumbers or managers of a car wash actually earn more money than some hospitalists, which is insane, because they don't have the same, requirements, the same burden, the same liability, and it's really unfair. And now, with all the quotas being run by pencil pushers, and, this is no criticism, it's just the way, the economics works for some people, but not for the docs, is that now you have to fulfill all these different quotas. And now with all the information, all the regulations makes it even more difficult. And that's why doctors are just having the hardest time. They're spending easily, was it 4 hours, maybe 25%, 50% of their daily work time on EMRs, on the administrative parts, all the documentation, and then the billing. And then if they don't get it right, insurance companies are happy to deny claims because there's one, thing missing. And the amount of time that goes into getting any kind of minimal reimbursement, because everything is being reduced, makes it harder. So doctors are forced to spend less time with the patients. And so it's a very let's say, dysfunctional environment. Let me just put it that way. And so it's
But
hard.
the
So
quality of time too doesn't need to suffer, and that's the problem. Like you may have less time, but the quality of the time is suffering too, because
Mhm.
you go into a doctor's office and you see your doctor
Yep.
literally just typing, or if they're focused on you, they're spending their nights typing, right? Doing
Yep.
that later.
Yep. So I'm glad that someone like you is coming up with some solutions that will absolutely dramatically change how we get to do things. But then again, I mean, I think it's also what I love about what you shared, and then I'm going to give the floor back to you guys, because the biggest part is this, and one of the biggest challenges is this as well, is that the consumer has basically abdicated the responsibility of their health to someone else,
Right.
and that is no longer a good. Well, it's never been a good thing. But with what you're offering, there's a great opportunity that people now get the information that they need. They can be educated. Now it's the responsibility of each individual to be educated, to understand their data, and then to start making the right decisions. So the floor is to you guys.
Yeah.
So,
So go ahead.
no, I was just gonna say that when I met Maggie, and she told me that she had her master's degree in biomedical informatics. I didn't know that was a thing, right? I thought she made that word up just to impress me. So I had to go and look it up. So apparently that's where, like, you have the medical doctors that speak a certain language, you know, with medical terminology, and then you have programmers. And a lot of times these people never get to meet, and that's why we find those programs so difficult. Somebody like her speaks both languages. So she can speak to the doctors, figure out what they need, and then go tell the programmers what to do to make that an integrative process. And then with some of the things, and I'll let her speak to this, where you're using now in the time that we live in artificial intelligence to enhance that, to change the way that we do things, to change the way that the processes occur. And an example of it would be, like, I have an X-ray software that when I put the points on it, it's very sophisticated, analyzes it and looks at it. But now the AI is learning through my office and a few other offices on where those points should be, and it's able to mark those X-rays and get all the measurements, all the angles, everything by itself, and
Yeah.
do it on its own as it gets programmed. So, you know, I'm excited to hear about where this is going to go in the future.
Yes. So it's like so many different aspects that can be discussed, right? So you have those that are creating the solutions, and some are just technologists. It may be the greatest technology, but you put it in front of a clinician and this is not how they work, right? And so what I love about what my organization does, we have clinicians actually building the solutions. We bring in clinicians that are part of the design, and that's why it's, you know, a term we call human-centered design. So it's all about looking at all the people that are involved, from the patient to the user to every aspect. What is the most efficient way to develop and give them the information that they need, right? Technology should be a catalyst and a tool to allow you to do your job, right? And give you the information that you need. And then we have data. Right now, data is not the issue. There's data everywhere. We have too much data that sometimes the doctor's like, yeah, we're going to redo all that anyway. And I'm like, because it's all disparate. And so interoperability is actually the biggest problem. And that goes back to who owns the data. There is a reason why me as a patient, I don't have to follow HIPAA guidelines, because my information, I could post my information on social media if I want to. It's my data, but I'm not empowered to own it. I don't have the access. I have to go through a million portals. Some is on a CD, some is on paper, but we have the Cures Act that was put in place in 2020. And it was it's a law that was supposed to be put in place by 2023. It still, you know, keeps getting delayed, that required healthcare providers to give direct access electronically to patients, providers and payers. And so through a third party. So I should be able to access all of my data in a consolidated manner. Today, that still doesn't exist.
You know,
right?
and that's true, because sometimes I have patients come in and they're telling me that they're having trouble getting their records from their other doctors because they were trying to keep them within their network, you know. And when she told me that, I was like, oh, so that's illegal.
And then the quality of care suffers because, there's been times I've gone in, I couldn't access the record, and it was actually easier for me to tell a doctor, I didn't do that test. Let's just do it over. When I know that I did it, but I just couldn't access it. I was like, forget it. And then you have, our president signed an executive order on October 30th of this year for an executive order around artificial intelligence. And there's actually going to be a healthcare interagency put together to identify ways that AI can support the healthcare system, but also look at the risks involved. Because everyone's worried about, with the more technology you encounter, the higher your cybersecurity has to be. And so there's risk, but as long as you can mitigate that and understand that there are ways around what we have just done, right? Like today, the technology exists for a clinician to have a conversation with a patient, and that whole conversation can be captured and put into it. So that technology exists. There's multiple solutions out there.
That's fascinating, especially, talking about this concept of whole health, not holistic health, but whole
Yep.
health. And then using AI to make all the interpretations that, is simply not possible for any human being. As I mentioned, doctors are becoming even more and more myopic, and we have to become even more and more open. Not that we get to know more stuff, but we have to collaborate with more people and the technology to make it so much easier. So we suddenly expand the amount of time that we can spend with our patients, because that, as you alluded to, spending that quality time with the patients, quite frankly, is probably more than half the healing process that people will be able to experience. It's not just about diagnosing and giving somebody treatment, but it's that human connection. And this is why AI is never going to be able to replace humans in the context of being able to get the best possible results. Maybe in some ways it will, but to get the best possible results, you need a human hand touching the body to make sure that really changes. So I'd like to wrap it up here. Thank you so much. Dr. Haas, you got the last word, and give me your last words, your last thoughts, and then how do people find you? And then we'll go with Maggie, and then we'll wrap it up. So Dr. Haas?
Well, one of the things that Maggie has taught me is really clinicians working with whatever software it is that you are using. Find out if there's a way that you can actually be a part of the decision making and the process that's happening, and the things that you want to change, and giving that real-time feedback. Because one of the things that I'm seeing with doing that is that those changes are made a lot faster, and the things that I have issues with, all of a sudden the next week I'll get a patch to it. So really learning how we can be a part of the process and changing that is going to make a big impact on, our patients' outcome, which is the number one thing, but also it'll affect us and our time and our mental health, as physicians in treating the patients.
And Maggie doesn't know this yet, but I'm going to do a separate interview of her for my masterclass, Fuel, designed to help doctors reimagine the business of their practice, business of their medicine, so that they can be more effective and thrive in today's world and have better outcomes with all their patients. So, tune into that. You can go to my website, drrademaker.com. Maggie, final thoughts, and how do people find you?
Yeah, so we're in such an incredible time in history when it comes to technology, and this is an opportunity for everyone to be part of what that change looks like, be part of the design, be part of the regulation, really drive what that future of healthcare looks like. Don't wait until the regulations are said for you and then you're in a state of suffering, right? Let's be proactive and really rally together and identify what does that future look like. And the way to do that is bring innovators into your organization to identify, okay, where is there opportunities? What can I do? How can I change? But there needs to be a willingness to be open and to change and have some unconventional thinking. And if you do that, I promise you, you will be part of the change, you will be heard, and you will like the outcome, and we could move the needle on that physician burnout and definitely drop that below 63%, because that's absolutely unnecessary. And you could find me today on,
No, go ahead. They find you where?
You could find me on all social media platforms. I'm on LinkedIn, Instagram, Facebook, Maggie Solomon.
And watch out for that TED Talk. And so, thank you for saying that, because the reality again is that as doctors, we may complain as much as we want, and as consumers, we may also complain as much as we want. But when I also talk about responsibility, which lies in the consumer's hands to, educate themselves, get the information, and then also guide the doctor in some of the things that they may not know. But it's also the doctor's responsibility to take action when it comes to their future as a health provider, with all the things that are coming out. And oftentimes we've just abdicated, our role and responsibility in designing a better, health system, future health system. And so that's part of what I like to, contribute to my master class, is helping doctors basically reimagining their strategy and approach to medicine, which actually includes mindset and things like that, and just like you said, keep an open mind. I mean, conventional medicine is great to a point, but there's a lot more that we need to start looking at, and especially, how is it that we interact with all the quick, advances in medicine. And one thing that, I talked to you about before, this concept of outmoding, which is a real challenge for doctors, because with technology, advancing so quickly, you reach a point where if you've acquired that technology, it's no longer working for you, and now you have to kind of recalibrate or re-advance the new, get access to new technology, I should say, and that takes a lot of time. And so whatever it is that we can do to facilitate the process by which we can use technology and information, it's going to make a big difference. Dr. Haas, we did not mention how people get a hold of you.
So Dr. Hasim Mohammed. So my website is delraychiro.com. I'm on Instagram, Palm Beach, so PB Posture Doc, or Facebook as Dr. Hasim Mohammed. So, and if you go on the CBP, the idealspine.com, I'm listed on there as well. That's a good place to find other CBP docs too.
I love it. Well, thank you so much, both of you. You both are an inspiration. You both are designing the future of the health system, and I will be interviewing you both separately, for the masterclass Fuel, because your information is so vitally important for us doctors to know, so that we can do things differently. For Dr. Haas, in the context of the structural aspect of our bodies, which is a preeminent factor in our overall health. And of course, Maggie, in our own personal health and the ability to serve our patients on the highest level. Once again, thank you so much, both of you. My name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, bringing to you the insights and the action steps that you can take, and so you can make better decisions to optimize your health. We're all in it together, but we also have to assume that responsibility together, because at the end of the day, there is no excuse to be sick anymore. Some people may not like that statement, but the truth is we've got all the information and the incredible people out there like Maggie and Dr. Haas. So don't have an excuse. Thank you, and I'll be back.